back. We're talking about a disorder that a lot of us suffer from through the winter months, some in the summer as well. Eczema that we're talking about today. I myself am quite a sufferer from this condition on my hands, sometimes on my arms. It's a real pain. Misa Manshadi joining us from Manshadi Pharmacy. It's great to have you on the show.
Thank you, Susan.
Yeah, this is a big problem for a lot of people.
Mm-hmm. Yeah, unfortunately, there is no cure for it. But lifestyle changes and treatment option, you can keep it under control.
Absolutely. We have pictures. I chose these pictures myself because almost every one of them looks like a form of the problem I've had. Some people getting it behind their knees, Misa. I know for me, my hands, sometimes my face,
yes,
and my arms are the worst areas, but it's different for different people.
That's right, but mostly hands behind, elbow, behind their knees, and sometimes on face. But usually the behind the knee and elbow is quite prevalent.
Mm-hmm. I've had a few times break out on my face, and Marcel's had to shoot wide shots of me on the air so I don't look funny, but it's a fact of life for some of us. I know for myself, Misa, I broke out as a baby and had it on my cheeks. Is that sort of a sign for some people who see their babies get it, that they could have it when they're older?
You got it. Mostly by the time they are 5 years old, that's when we see the signs of eczema.
Right.
1 year old to 5 year old, they are 90% of them, we will see the eczema in that age group that it starts. Mm-hmm. But sometimes we see the people that they have asthma or allergy to the food groups. Those are more prone to have eczema.
Mm-hmm. We have a couple of boards we're going to look at. The first one talking a little bit about the triggers. So let's spend some time on this.
Correct. So this is the lifestyle changes that I was mentioning. So soap, detergent, perfume, and some of those things triggers the eczema to come out. So be aware of that. Anything in the air, preservative, microbial agent, anything antibiotic, antifungal, candida can bring it up. Certain food, which is usually can be sugar, can be eggs, can be milk, can be soya, can be peanut butter. So be aware of that if there is that's related to one of those triggers. And we see sometimes with the hormonal problem, stress, and climate. You know, some people they have eczema during the winter. Some people they have it during the summer when there is a humidity, when there is perspiration, and when there is hot. So it's nice to know what is out there and what the triggers are. Some people they say they don't know, but maybe they can start to have some kind of a diary and see when it flares up and when it goes down, so they can pinpoint it.
And I think that is key, is to sort of write down the triggers and figure out what's going on at the time. I myself, and I just wanted to introduce this because this is what's worked for me, eliminating sugar. I eliminated sugar from my diet for a solid 2 weeks, everything from my coffee right down to any desserts. And you know what? I love sugar. I eliminated it. It was gone. It really was. Like, sugar for me is a trigger. It might not be for everyone, but if you can choose to eliminate all or most of your sugar, it brings huge relief. Because you know what? It is life compromising, Misa. It really can be.
It is. And they found out some people that they have allergy to cat, elm, or eggs, or they do have more, these children have more eczema in their bodies.
I'm allergic to cats. There you go. We also have a second board talking a little bit about prevention and treatment.
So when we talk about cleanser, it's nice to clean the area, but we should avoid things that has too much foam, too much perfume, too much fragrances and preservatives and so forth. Gentle cleanser, I brought one in here that we can look at it later on. If it is also possible, do bath more and shower less. And sometimes people, they put the emollient or oil inside the bathtub, so that's a good point. However, we shouldn't stay in the bath or in the shower for a long period of time, and we shouldn't use too much hot or cold. Lukewarm water would be the best. One of the most important things for eczema sufferers are moisturizing. A good moisturizer with the hyaluronic acid and ceramide will work very well. They should apply it maybe 4 or 5 times a day if it is possible, especially after shower or bath, to keep the moisture in. And sometimes when they are really suffering at bedtime, they can use antihistamine, the older antihistamines such as Benadryl, which makes them sleepy. They can sleep better, and hopefully they don't feel the itch as much. And obviously, if there is, they cannot stop it by lifestyle changes and using moisturizer and cleanser, then we sometimes recommend corticosteroids. They are good corticosteroids available without the prescription at your pharmacy. Please seek your pharmacist and ask about those, and they can provide it to you. There are some other, immunomodulators that they are new as well, that is in the market. However, they are very expensive, and I feel that corticosteroids, the one that we've been using it for the past 25 years, it works good and it is efficacious, and there isn't much of side effect. So I usually promote those if it's possible.
But sparingly, of course.
Sparingly to the affected area, that's correct.
Yes. And we have these examples of some of the moisturizers. I've used them all. They all work, they all have their place for sure. I'm not against getting if you have severe eczema and it's compromising your life, to get that prescription, but sparingly. It's hard on your skin, and that's the bottom line. So
Sure. So the first one would be a good cleanser. So you want to cleanse the area. This is a good moisturizer, and this CeraVe is also a very good moisturizer. Remember, if it is possible, after bath or your shower is the best time to do it, and do it 3-4 times a day. I have this product, I really like it, is hydrocortisone plus urea, which urea keeps the moisture in, and hydrocortisone gets rid of the rash and redness. It's sometimes embarrassing, and if you have it inside of your face or something. So these two prescription, it's not non-prescription products are available at the pharmacies. As you were saying, you want to use it sparingly, and we have a doctor in town, Dr. Lewis, which recommends rice to toonie ratios. That means if the eczema is as big as toonie, you use as much as rice of corticosteroid, and you apply it sparingly, often maybe for 10 to 14 days, and then once it's cleared up, you use your moisturizer.
Perfect.
And intermittently, you can use these corticosteroid products, and they are safe and effective.
Okay. We are out of time. Misa, a great topic today. A lot of people affected by this, especially in dry climates like where we live. So thank you for that. Information on the screen if you would like to learn more about this. 2 locations to serve you, of course, on the South Shore and the North Shore. We're back in a quick couple of minutes. Stay with us.